Host, Will County Executive Larry Walsh.
Hello and welcome to another edition of Will County at Work. I'm your host, Larry Walsh, and my guests today are Dr. Kathleen Berke, the county's Director of Substance Use Initiatives. We are proud to have Chief Steve Vaccaro from the Mokena Police Department and the Chief Terry Lemming from the Lockport Police Department. They are going to inform us about a new program, Safe Passage. And this is Safe Passage is offering people dealing with opiate addiction a connection for treatment. Thanks to you all for joining me this morning.
You bet.
So this sounds like a very needed program and an interesting one to say the least. So Kathleen, Will County began addressing our issues with heroin in our communities back in 2010, and we started with education, working with you when you were the CEO of Robert Crown, and you brought together a heroin prevention curriculum to the children of Will County. Correct. So why don't you give us, as a background to this program, what we accomplished and what you put together for that?
Sure. In 2011, thanks to you and the identification that heroin was a crisis, we were in the midst of putting together a curriculum to address what opiates were, because kids didn't know. That was not part of their drug education curriculum. And so we offered a 7th and 8th and 9th grade curriculum, and thanks to Will County's interest, and your interest particularly, that prevention was the way to address this, that we needed to stop it before it happens, because it's such an addictive drug, that we were able to come to Will County and pilot that program through our schools. And since that point, we still are using the curriculum in Will County and extending it and expanding it. And this year in particular, they've changed it a bit, and so it's more accessible to more schools, and we're going to continue that expansion. And once we were well on our way in the schools, then we realized that people were still dying, and we still had to do something about it.
Yes.
So we looked at harm reduction, which meant that we were able to offer naloxone, NARCAM, it's called both, to first responders, our police officers in the field, who would get to an overdose victim first, and because of the NARCAM, could literally reverse the death. And so that's been our strategy, along with education, harm reduction. And the police officers program, Safe Passage, is also a harm reduction strategy.
Okay. Just as a guess, how many children do you think we have educated over the years on this harmful drug, heroin, and tried to inform them and show them the dangers of drug use, which we still are in a couple of different schools with programs. Yes. Are we down to the 3rd and 4th grade level? We have still 7, 8, 9, or 7, 6, 7, 8. But we must have put this program before thousands of
at least over 2,000 children.
Yeah, absolutely.
And there are other programs that are going around in the schools too. So
are there?
The lower grades. So I know in Braidwood and Wilmington they have a program.
They on their own they went out and did things like that.
Yes.
Well, that's great. That's great to hear, because I think in education and informing them, we have to keep that in front of them all the time. Recently, we all know there's been a significant rise in the abuse of opiate prescription drugs, and which have altered our focus to include all substance prevention, where we were just at heroin first, and so earlier this year we brought you on board with these efforts, and that's very important, right?
Yes. What we're finding that the path to heroin is prescription pain pills, and that can start as young as someone in high school with a sports injury that gets prescribed a Vicodin or Norco for pain, and if that person feels better on that drug, or if they take it for 2 weeks or more and have a genetic predisposition to addiction, it gets them in trouble, and they like that feeling, and they start to use it. They start to use it on the weekends, it's at the parties, and or it's in somebody else's medicine cabinet, and before you know, we've got an addiction on our hands. And when people get addicted to prescription pills, either their doctor stops prescribing it, they start having trouble accessing it, and it's expensive on the street. So we find that our children then go to the street for heroin. So that's where we first caught the heroin epidemic, because it was such a new experience for people to die of heroin or to be using heroin. But in reality, it starts back in the physician's office often with the prescription.
And I think you hit on the magical words to your own medicine cabinet. How many drugs, addictive drugs, could be in at a home, that was prescribed by the dentist or something, so
right.
And they give you 30 pills and you take 3 of them.
Exactly.
and then the rest of them are there. And so parents should really do some, looking into their own medicine cabinet and see what is proper and what could cause problems in their own family.
Exactly. I know a lot of people, like, when they don't use their entire prescription, keep it for a rainy day,
Yep.
and there might be a
Yep.
pain. Bad news, because
Yep.
it's accessible to somebody else, and you really don't want to be self-medicating without a doctor's understanding and prescription. So in Will County, we have a program for drop-offs of
Yes, we do.
prescriptions.
Yes, we do.
So we encourage everybody to check out their medicine cabinets, check out their grandparents' medicine cabinets. I mean, that's another place that we've seen in the nursing homes. When somebody passes all those meds, they give it to the family. We have drop-off boxes that you can go and drop them off.
Mm-hmm. And we've been very successful in starting that back years ago, and had a number of drugstores and prescription shops that were partaking in that program with us. Also, I think a number of police departments also stepped up to the forefront, and also provided a drop-off spot for unused prescription drugs.
Yes.
Great.
Yes.
So,
and what we ask people to do is to put them in a baggie. You can toss the bottle, and then you can just take the baggie and drop it off at the box, because that way it saves the amount of garbage that we have.
Yeah.
And it's more efficient for the folks who are collecting.
Yes. Well, that's great. We look back and we started with the education, and now we're focused on harm reduction, and by expanding on our naloxone and training across the county, and that's been a very, very important step in the direction of drug overdose reduction.
Exactly.
So can you explain a little bit more in depth on what that is?
Sure. Education is a long-term strategy.
Yeah.
So you want to prepare children when they're young, so that when they're older and in their teens, they will not use. But that takes a while to see an impact of that. Harm reduction deals with an immediate strategy to keep people from dying, so they can get treatment. And so I was hired because we received a large grant from the Department of Human Services through SAMHSA that is specifically to increase the number of people who are trained to deliver naloxone. We started in Will County with the police departments. They have all been trained, and now we're going to what they call bystanders. So these are folks who work with people at high risk, housing areas, social service agencies. I've trained bartenders. I've trained halfway houses, people and people who are in active addiction. So we're trying to get to people who are most at risk of overdosing. The other thing, our jail is going to be rolling out a program where they're preparing people for earlier discharge, but with medication-assisted treatment as well as naloxone, and we've been working on that for a while. So there's a lot going on to keep people alive, to get them into treatment.
Yes, and a lot of our first responders have joined in and been doing the training also, correct?
Yes. Through our Sheriff's Department, Jeff Jers has been very instrumental in getting people trained.
Yes.
And I train trainers. So once you're trained by me, you can then train your department, you can train your organization, you can train other people. So that's the advantage. Will County is a large county, and so we now are able to reach out and get to the corners of the county.
That's great. That's great. Well, you know, we've been involved in several state initiatives to address this opiate epidemic, and that's what we've been calling it ever since the start. So can you expound on some of the initiatives other than what we're doing here?
So there's a statewide advisory council that I work with, where it has representatives from all the different agencies, and the state police and the judicial system.
Was that created after legislation in state of Illinois? Was that created by that legislation?
This was created because of the grant.
Oh,
so
okay.
The grant required that we have all those voices around the table. There is also a higher level department head committee that's been working on a strategic plan for reducing opioid deaths. But the committee that I sit on has 4 areas that they're looking at. One is prescribing, physician prescribing. And so we want to reduce the number of prescriptions that are prescribed by doctors in opioids. There are other strategies and other alternatives. The other one is education, community education, understanding what's going on about the opioids, understanding that you don't have to take a pill, 30 pills when you're given it by your dentist. You don't have to accept that, and we're trying to let people know why that's not a good idea. And then there's through the jail system, so the incarceration, trying to make sure that people, when they leave incarceration, that they're not going to overdose. The 2 weeks that people get out of incarceration or out of treatment are the most dangerous weeks for relapse, and where we see a lot of deaths. And so we're informing and educating people and getting naloxone into their hands. The other committee that we're working on is medical assisted treatment. So the most effective treatment for opioids is both cognitive counseling and a medical assisted treatment, medication that assists. That's been evidence-based, and it's the most effective. So we are informing people about that and getting more doctors who prescribe medication in our community. We do not have enough in the spread throughout our community. So the focus is to reduce deaths. I mean, bottom line is, how do we reduce deaths? We want to make sure people aren't dying and get an opportunity to get into treatment. And so I really enjoy sitting on that committee, because you hear from all over the state what's going on. And the rural areas are a little different than us. Lake, DuPage, they're different than us, so it's important that we have a community-driven initiative.
Well, that's great. I know with your help and a lot of others, Anastasia's help, Will County and has really jumped to the forefront over the last 6-7 years, and in bringing this issue to the forefront. and really wanting to move forward on trying to, if best we can, eliminate overdoses of heroin and opiates.
Exactly.
And what do you think has the state? I know lately, the number of pieces of legislation, thanks to some of our representatives right out of Will County, Representative Manley and Jennifer, Senator Bertino Tarrant, and others have done a great job, and leader Representative Lou Lang on the House. They've been doing a great job of moving things along.
House Bill 1 was a historic bill.
Yes.
And it put in place the opportunity for me to be able to train other people besides police officers. So it was because of House Bill that we are spread.
Yeah.
House Bill requires all officers now to carry naloxone, and we're still rolling out the requirements from that bill. But those legislators were very instrumental, and they listened to what was going on and they responded.
And even a step further than that, we can thank our congressman from the 11th District, Congressman Bill Foster, that he brought this issue to the forefront in the U.S. Congress and got some needed legislation through also, right?
Right. Well, we thank Senator Foster, or Congressman Foster, because he understands the issue.
Yes.
He's a scientist, so he understands. Yes. And so in Washington, he's the voice that is, I think, responsible and
respected,
helping people understand what addiction is and getting the money to us, because we are one of the hot spots.
That's right. That's great. But working together in collaboration, we can get things done.
Absolutely. It takes a village.
Yeah, it does take a village. Well, let's bring our police officer or chiefs into the discussion, and they got a lot to offer. So, Chief Carl, you reached out to Will County for assistance in creating this Safe Passage program to help people addicted to opiates. Can you explain what the issue is with Safe Passage, what you're trying to accomplish?
Yeah, I'd be happy to. Probably a little over a year ago, we saw an increase, obviously nationally, in opioid abuse and opioid deaths. And I was looking for a way to maybe help our residents if they had an issue. And because of your Will County Helps initiative, I looked at that. Unfortunately, it's the educational side.
Yes.
So I came to your office and asked you if you were interested in the intervention side, because I knew I couldn't do this alone. What was interesting is at the same time I happened to speak with Chief Lemming and Chief Mayton from the Lamont Police Department, and they were trying to do the same thing that I was. So we essentially pooled our resources. We came to you, and with the help of your staff and Anastasia and Dr. Berke, we were able to successfully start the Safe Passage program.
Now, I think there's other areas in Illinois that have already created, say, a Safe Passage program that you modeled off of?
Yes, Danny Langlois is the chief in Dixon, Illinois.
Yes.
And he's got a very successful program.
Yes.
And we look to model our program along the lines of what he's doing. And ours varies a little bit in a few different aspects, but all in all, it's pretty much the same program. Anybody can come into one of our police stations, let us know that they have an addiction, let us know that they're looking for intervention, and we're happy to help them out.
And so, is this addiction just to opiates, or is this an addiction if people want to come in and they're addicted alcoholics or any? Do they qualify for help through this Safe Passage program?
The focus is obviously opioids.
Yes.
But we're not going to turn anybody away. Anybody comes in with an addiction, if they're addicted to alcohol,
and they
cocaine,
really want to make a change in their life,
that's correct.
You're going to help them and steer them in the right direction.
That's correct. We won't turn anybody away.
That's good. And they don't even, as users of the drugs, there's no fear of repercussions of coming in and saying you're an addict and you want to get help.
No,
Is that correct? That's correct,
No
right?
repercussions at all. They
Yes.
come in the door, let us know that they're
Yes.
looking to help
Yes.
themselves, and we'll do everything we can to get them immediately into an intervention program.
Right. Well, that's huge. I mean, I don't think we even got a state program anymore that it helps with addiction, do we, Kathleen?
No, it's very, very hard to get into treatment.
Yes.
And it's,
Yes.
the individual has to get themselves there.
Yeah.
And they don't know how to do it. They don't know
Yes.
what it's about. So having the police officers be able to guide them through volunteers is extremely valuable. And we've seen success. We've seen people request a treatment. We just rolled it out. So, in particular in Lockport, Lockport's had 6 people who've gone to treatment because of the program.
Super. And Chief Lemming, is somewhat progressive program. Traditionally, over the past, police officers were looking to arrest drug users and that. And so this is a program that's really a more compassionate and understanding and willingness to help program, correct?
Yes. It is a very progressive program, and I give your office a lot of credit for being involved initially in it. It's not a traditional role for police officers to assist. It's more of a social service role.
Yes, right.
But we realize, we meaning all of us, realize that we're not going to arrest ourselves out of this situation.
That's right.
And we need an alternative method, and why wouldn't we give this new safe passage program a chance?
Yes.
We have. It has not worked in the past. For instance, last year we had 6 overdose deaths in Lockport. This year we've had 3 so far. So we're operating at a pace about the same as last year. But what's important to note is that we've had 4 saves through NARCAM this year. So you can imagine we would have already surpassed last year if it wasn't for the saves, it wasn't for the NARCAM program. So this is a very unique program. Police officers are normally used to arresting heroin addicts because the nature of the addiction is that heroin addicts will do anything for the drug. We know that. Yeah. And many heroin addicts resort to crime. So police officers look at heroin addicts as criminals. So now we're asking police officers to look at them at heroin addiction as more of a medical issue. And that relapse, it's hard for an old dog like me to think that relapse is part of recovery, but I've learned more about the addiction to heroin, and it is absolutely part of the recovery part of the recovery. And we as police officers may see these people twice. We might put them into treatment 2 times, and the traditional police response would be, they're criminals, we're not going to help them. Yeah. So we have to change the mindset of our officers, which we're doing. And it's a little difficult, but I think we're gonna win this battle, because the officers are going to see that they're going to have less response to domestics, less response to retail thefts in towns, robberies. Many of the serious crimes committed in our communities throughout Will County are done because people are addicted to drugs. Right. So we believe the Safe Passage program is an alternative to an arrest.
And you hit on a good point. Are all of your police personnel being trained to work on the safe passage and get to understand it and support it?
Yep, they are.
Yes. And it's going over well?
And surprisingly, they're all on board.
Okay, that's good to hear. That's good to hear. So, Steve, can you tell me what types of people are coming in? I mean, I know you keep records on that and statistics, and is there any particular age group or gender or that's more common than not?
What we've seen in Mokina is males
Male.
We've had no females. Age range is about 25 to 40. Could be your next door neighbor. We had one homeless gentleman, transient.
Not school kids?
No.
Not school kids?
No, thank goodness. We've had one transient gentleman who thought about it and came in and got some help. And we've had 3 residents. One kind of connected to a business owner in town. So it could be your next door neighbor. It could be anybody who comes in. And we've seen the program so far very successful.
Heroin does not know any boundaries.
That's right.
No matter what. Same thing for you, Chief Lemming.
We've had 6. We've had the 3 males, 3 females, teenagers, all the way to 44 years old. And a 44-year-old female come in last week, and the week before we had a 30-something male who was homeless. His parents or his family lived in Lockport, and he was living under a bridge under the Eisenhower Expressway near Chicago, which is the Heroin Highway, the day before. So he's homeless, living under a bridge, with no means of support. And what we find is the heroin addicts that use the program are at their last rope. They have no other options, and they come to us. This is it. They understand that they're going to die. They understand that they're going to die of heroin, and they come to us seeking help. And what's unusual about our program is, I was a former undercover narcotics agent, and I dealt with addicts all the time. And some of those that would assist in the investigation, the addicts, we would try to get them help. And it would take 30 days to get them into that program.
Yes.
Well, as we know, as Dr. Berke knows, that the nature of the addiction is that they will not, they come in when they want to come in. And if we wait, if they have to wait 30 days, they are not coming in 30 days. When they're at the end of their rope, we have to get them treatment. And that they come to the police department when they're at the end of the rope, and we need to get them into that program immediately, which all 6 of them immediately went in, same with Chief Vaccaro. But what's really important about this program, what we're doing right now, and the fact that we're filming this, is that we need to get the word out. There's still a lot of people that don't know about the program. So we need your help in that effort, is getting the word out about the Safe Passage program so we can help more people, because there's more than 6 heroin addicts in Lockport. I guarantee you that. And we need to help more people. We need to get more people in the program. And if we save one life through the whole Will County Safe Passage program, it's worth it.
It's worth it. That's exactly right. Kathleen, what really is the most effective treatment for someone who is fighting an opiate addiction?
Well, as I mentioned, that we know that treatment with cognitive therapy and medical-assisted treatment. Medical-assisted treatment could be methadone, Suboxone, or Vivitrol. Those are the 3 methods we have now in combination, because your brain changes when you're on an opioid, and when it changes, it still craves the drug, and that we've seen has been a major reason for relapse. And so with that combination, we have more opportunity to keep people in recovery. But the other thing that's really key is that the treatment, when you're in a treatment facility, that's one part of your recovery. And we don't have enough beds for people to get into treatment, which is why it's so hard and why we had to facilitate it through the Safe Passage program. But when you are not an inpatient, you still go to therapy and you still are treated, and you go to group sessions. But as you progress in your care, you need to be around people who are also fighting that. And recovery homes are the most important thing that we could offer someone for long-term recovery, because there you have a group of people who are working for the same thing. They want to stay in recovery, they support each other, and they work to keep their family, trying to put their family back together, because often the families are really challenged during this whole process. So it takes time. It takes a long time for someone to just stop the feeling that they need the heroin. It's both physical and psychological. And so I know through our program with the jail, drug court, they have a halfway house, a recovery home. And we need to replicate that for everybody because it is a very successful wraparound services are needed everywhere. It's not you get out of treatment and you're fine. That's not the case.
Drug court in Will County has proved to be very, very successful. And a lot of, I think we've had over maybe, I don't know, 300 graduates out of the drug court program since it became a reality. And I give our judges, Chief Judge Shainstead and State's Attorney Glasgow credit for all that they do. Julie McCabe-Stir, great job in helping out people. But that needs to be, it isn't a 5-day-a-week program. It's a continuous program. We've got to be continuously looking at that. And the issue is we need to look into prevention more than incarceration, basically. And if we put the money in there and that help a person out, you're going to spend $30,000 to $35,000 a year incarcerating somebody in jail, and how much that would go toward helping them through a prevention program.
Exactly. So treatment is key, and locking people up does not get them well.
No.
And we know that, and the courts know that. And Will County is doing some things now that are very progressive and being on top of this to try and get people into treatment as opposed to incarcerated.
Yes. One night when we were doing the forums a number of years ago, it was about bringing the issue of heroin to the forefront. We were in New Lenox, and a mother told me that she would like to, her daughter would love to get her daughter, and she said she felt bad that the only way to help my daughter is get her arrested and get the state's attorney to put her in a drug court program. And how sad is that? How sad is that we don't have the capabilities of having a facility that we can go to and address that? So
see, that's why the Safe Passage program is so important.
Yes.
Because people trust the police, okay? And their families trust the police. So when someone comes to them, they know that they will be well taken care of. And we don't want them to have a felony on their record because it shortens their ability to have a job and everything else.
The rest of life.
Yes, and so we want people to feel that they can come and get help. One of the disadvantages of many people is they don't have insurance because they've been kicked out of their family, or they've just got out of the system. There's no assistance for them, or they haven't signed up for it. Because remember, someone who's addicted, their only goal every day is to get their drug. And so they don't sign up for Medicaid, or they don't try to get temporary housing. So when we are working with people who have no resources, we have the ability to ask foundations to assist us in getting people into programs that will accept them. When someone goes directly to a treatment facility, if they're in that case, they're not going to be accepted. And they don't know the facilities that will accept them. So this is a
huge starting point.
Yes, absolutely.
Chief Lemming, if somebody came to you from a different municipality, I mean, and somebody from, let's say, Romeoville would come to you, you would help them through that Safe Passage. Is that correct?
It is. Our initial program that we all agreed to, we were only helping the people that lived in our towns because we didn't know we could handle anymore.
Okay.
But what we do is we do call the treatment facilities and arrange for them to get the treatment.
Okay, so that would be their first step, somebody from out of town, that you would initiate help for them.
Yes, we did have one that was from out of town, and we helped that person like they were from town. I mean, we didn't transport them, which is normally what we do, because we have an agreement with our fire department that they will transport to the hospital for free for detox.
Okay.
But this person didn't need detox, but we arranged for that person to get treatment.
Okay. Same with you, Steve?
Same with us. We did have a resident of Frankfort that came in because he knew of our program, and we were able to arrange for intervention.
So then this brings up the idea that we need to get more municipality police forces on board with safe passage.
Yes.
Is that right?
Yes.
So
we're already talking to the chiefs of Monee and Romeoville, and they're determining if they want to be involved. And they were at our last meeting, but we'd sure like to see it at some point be a county-wide initiative.
That's a great idea. Yeah.
But we have to first expand it slowly, in my opinion, because we have to see that the treatment centers can handle all the new patients.
Well, I applaud all of you for what you're doing. So Chief Vaccaro, if there was one thing that you would like to get across to the viewing public, what would that message be today?
Well, I think the message would be just to realize that there is an epidemic, and you may be part of that. You may be an addict or an abuser, whether it's opioids, alcohol, prescription drugs. If you need assistance, you can come right now to any of the 3 police departments, Mokina, Lockport, or Lamont, and ask for assistance. You don't have to fear any repercussions. You don't have to fear arrest. We're here to help you out. We have the means now to help you out. The other thing is that we hope that this will go countywide very soon, and that was our vision when we put this together. When I sat down with your staff and with Chief Lemming and Chief Mayton, was that our goal was that this would at some point go countywide and maybe be a model for other counties. And we have to credit Chief Langloss and Dixon for allowing us to use his model. He sent us everything with no questions asked and said, use this, and it's a great model.
Are you working as our county coroner, Pat O'Neill, involved in any way, shape, or form with this?
I believe from a statistical perspective, and Dr. Berke can probably speak more to that because he deals with it more than we do. But from the police chief's level, not necessarily, but from a statistical perspective, he keeps us up to date on those numbers.
Would you like to add anything, Chief Lemming?
I would just like to say that every heroin addict was a little baby that their mother looked at. Cute little baby. Yeah. Every life is worth saving. Every life is worth saving. And that we, as police officers, looked at these heroin addicts as criminals. We're changing that mindset right now. But everyone now knows a heroin addict, whether it's a family member, a friend, or an acquaintance. And if somebody said they don't know a heroin addict, it may be kept private, but it's somebody they know is involved in heroin. It is a terrible, terrible addiction, a terrible epidemic.
Yes.
Every life is worth saving, and the Safe Passage program is here for that reason.
That's great. That's great message you put out there. So as we come down to the end, Dr. Berke, give us some information. Is there other programs that are available? Does your office here now at the county office building have all the information that people can get a hold of you, email you, or whatever in regards to being maybe taking the first step to help one of their loved ones or somebody that they know that's an addict? I
am working to become a point person for resources, so people I can help direct people to the appropriate people that they need to talk to, and also to find out what we have in our county, because we do have a lot of things and people don't know about them. So I'm collecting that data all the time, and I'm working with the coalitions. There are some other coalitions in the community, and they're working with me to be able to bring programming and naloxone training to their community.
So programs like Stepping stones?
Well, stepping stones, and I've had a lot of conversations.
Yeah, okay.
Because they are a very good facility, and they're packed. I mean, they don't have enough room for as much demand as we have. So we're having those conversations.
Yes.
So what do we do?
And has the hospitals played a role at all?
St. Joseph's I've had conversations with, because we have through our health department, we have a collection of data under the MAP program, and that collects MAPs is really important for us to know what's going on in the community.
Yes.
So we know that we do not have enough services for behavioral health because of the research that was done. So we, through the MAPS committee, we are responding to that and trying to make sure that we get more services into the county, and that people are aware of the services that we're getting. I do have one thing I wanted to add, if you don't mind.
Absolutely.
And chiefs will back me up on this. We have, heroin is, prescription pain pills and opiates and heroin have been the primary drugs of choice of people. What's happening now is fentanyl. Fentanyl is an artificial opioid that's being added and sold in our community. Fentanyl is 50 times stronger than heroin. More people can die quickly because of fentanyl. They don't know they're purchasing it because it's just being sold as heroin. People don't understand how strong it is, and they don't understand that they could die immediately. So we need to get the word out that fentanyl is in our area, and do not use it. Ask for treatment. Come get help, because we do not want you to die because of this awful drug.
Absolutely.
Absolutely. How do they know? They don't know
They
that.
don't know. No.
They think they're taking heroin.
Yes.
And it's fentanyl.
Yes, and I've even read something recently that it's getting mixed in with cocaine also. So it's I don't know why this is going on. It seems like an odd choice for the cartels to mix a deadly drug in with their regular product. But
unbelievable.
It's very dangerous, and what happens is that it's imported, and that country will outlaw that particular type of fentanyl, but then they come up with another type of fentanyl because it's made in the laboratories, and then that one gets shipped over to us. So it's a scourge, and I know the DEA and everybody is working very hard to get to stop that import. It's a dangerous, dangerous drug.
So you mentioned mental health, behavioral health, that we, Will County, very proud of the fact that Silver Cross Hospital has partnered with a group, and that they're in the process of building a 100-bed facility on their campus that will be addressing mental health, behavioral health over there.
50% of those who have an addiction have a mental health issue.
Yes.
And so we need to work at the same time to improve our mental health services and improve our treatment services. I want to encourage the public that 90-bed unit is critical. There are not enough beds in our county.
Yeah, I know.
To take care of people. But this is a
good start.
Yes.
This is a good start.
This is an excellent start.
Excellent start. So I'm very, because I know our Will County Health Department, Dr. Triani and his group has done as best a job as they can under the circumstances. Right. And so the issue of budgetary issues in Springfield, Illinois, doesn't help us at all, and is just an unbelievable detriment to our being able to reach out and do more for people, when, especially like Paul Lawrence and that Stepping Stones and stuff. So
you know, given the budget crisis in Illinois, those social services that are still in existence are supporting themselves for now almost 2 years without support from the state. That's amazing, and they should be congratulated for staying there.
It's a wonder they got their doors even open yet.
Exactly. And we've lost some of the small ones.
That's exactly right. Exactly. And that goes right to dedication, commitment, compassion, and people wanting to try and help other people. So that leads me into my final comments that I am very proud of all the efforts of all of you to help our residents and reduce the number of overdose deaths. The issue of opiate use has become a national problem, and it will take all of us working together to continue to help the people of Will County. So I really, really want to say thank you for joining me today and bringing this very, very important message to our residents of Will County.
Thank you,
Jace.
Thank you.